Hello everyone. Welcome to our webinar entitled Hospital Levels of Care, Documentation and Billing, a summary of concepts for healthcare providers. We're so glad you could join us in what will be a very important and informative webinar session. We hope that you can take what you've learned from today's webinar and create a more efficient coding and billing system for your individual group or practice. We will have a 5-minute question and answer session following the conclusion of the presentation for those who may have questions or need any clarification on topics that are covered today. Now, let me introduce you to today's presenters. First, we have Charles Anderson. Charles received his Bachelor's of Science in Economics at the State University of New York in Albany. Next, we have Andrea Hale, BSN, who received her Bachelor's of Science in Nursing at the University of Iowa. Next, we have Jacob McKeon, who received his Bachelor's of Science in Business Administration at Colorado Christian University. We also have Dustin Rodriguez, BSN, who received his Bachelor's of Science in Nursing at Drexel University. And lastly, I'm Pamela Tyler. I received my Bachelor's of Business Administration in Marketing at the University of Texas at San Antonio. Now that I've introduced our presenters, I will start by giving a brief introduction to the course. Coding and billing are important aspects of any provider's practice, especially when documenting for patients during a hospital visit. Detailed documentation is very important in communicating the necessary treatment for each patient to their health insurance companies. Payment systems of each health insurance company differ according to each payer category. For example, there are commercial payers such as Blue Cross Blue Shield, Coventry, Cigna, and United Healthcare, among a list of companies that provide medical insurance. There are also government payers, which include Medicare and Medicaid. And lastly, there are those who categorized as self-pay, made up of those clients who do not have health insurance and are responsible to pay out of pocket. Each of these payers will send payment based on accuracy of the coding and billing of the provider's orders, according to specific coding guidelines. Written communication is crucial in the first written order of a patient during a hospital visit, since it will determine the level of care of the patient, such as observation and inpatient care, and how that documentation is billed. Our webinar topics today will cover impact of physician documentation on billing and resources to assist in communicating a more detailed documentation, levels of care in hospital and use of utilization review nurses, reimbursement recovery, and readmissions and post-acute discharge needs of the patient. Next, Charles Anderson will start us off by discussing in detail the impact of physician documentation on billing.
Thank you, Pam, for the introduction. I will be discussing the role of a CDI nurse. A CDI specialist is a registered nurse who manages, assesses, and reviews a patient's medical records to ensure that all the information documented reflects a patient's severity of illness, clinical treatment, and the accuracy of documentation. A CDI nurse performs concurrent reviews of medical records, validates diagnosis codes, and identifies missing diagnoses. When documentation in the medical record is incomplete, ambiguous, or conflicting, the CDI nurse must seek clarification by asking the medical team to provide clarification. The role of the CDI nurse is to bridge the gap between the physician and coder, between clinical practice and the assignment of ICD-10-CM codes. Through the work of CDI nurse, a coder is better equipped to find the clinical intent of the provider. A mature CDI department can assist the medical team in providing concise, accurate documentation that meets both facility and professional coding needs without overwhelming the medical staff. The International Classification of Diseases 10th Revision Clinical Modification, as known as ICD-10-CM, is a system used by physicians and other healthcare providers to classify and code all diagnoses, symptoms, and procedures recorded in conjunction with hospital care in the United States. Coders assign ICD-10-CM codes based on provider documentation in the medical record. However, the medical record does not always accurately reflect the intent of the provider or the patient's clinical picture. This leads to inaccurate or unspecified code assignment. Coders are accountable for increased bill hold times and delays in accounts receivable. CDI nurses can positively impact the bill hold times by initiating and completing queries on a concurrent basis, which allows coders to work from completed records. Now I will let Andrea talk about the inpatient level of care.